All right, if you ask the CEO and the president of Catholic Health, he is optimistic that a last-minute deal can in fact be reached with the union ahead of a potential strike tomorrow morning. Good evening once again. I'm Scott Levin.
And I'm Mary Alice Demler. If a deal on a new contract is not reached by midnight, hundreds of healthcare workers at South Buffalo Mercy Hospital could walk off the job in the morning. 2 on Your Side's Michael Wooten begins our team coverage with tough questions for the leader of Catholic Health. Michael.
Mary Alice and Scott, negotiations are happening right now. They've been going on for weeks to try to prevent hundreds of workers from walking off the job. That strike set to begin 12 hours from now during the 6 a.m. shift change. CWA represents more than 2,000 workers across 3 different Catholic Health hospitals, but importantly, this only impacts South Buffalo Mercy. Last night, Catholic Health delivered a new proposal to the CWA. It includes pay raises with an average increase of between 4.5% to almost 9%, depending on the type of worker. Also, we're told most health insurance premiums would be unchanged, although not all. That's been a big sticking point. And then also some improvements to staffing, but we've heard from so many nurses especially that they just don't have enough personnel. Well, today I sat down with Catholic Health President and CEO Mark Sullivan for his first interview about all of this to get an idea on just how close the two sides really are. Catholic Health had said before that the gap was more than $100 million, right? It does seem like that has shrunk, right? Is it safe to say at this point in the negotiation with the clock ticking that the two sides are closer than you've been at any point?
We're closer than $100 million, but we're still apart. So, however, what I will say is that the proposal we put on the table last night addresses the key themes that you've heard in all the interviews you've done, addressing staffing, addressing fair and competitive market wages, addressing benefits. All those things are in our proposal as of last night.
Let's say you can't get a deal done by midnight. Could you possibly get a deal to give yourself more time?
Typically, when the organizations are as close as we think we can be, it's up to the union to say, you know what, we're making progress. Let's pull that strike notice. And we'll continue to bargain. And that is a possibility. That's not my decision. My goal is to make sure we have a fair contract on the table and avoid a strike, and that's what we're trying to focus on.
And obviously, if there is a strike, the negotiations will continue.
Yes,
as well.
Absolutely. Our commitment is to stay at the table until we have a deal with the CWA to protect our patients, provide the associates fair and competitive wages, staffing, and benefits, and that's our goal.
And Catholic Health has hundreds of outside workers here already and on standby in case that strike happens. The CEO saying that care will not be impacted during a potential strike.